We are here to reflect on how Kenya can better align its financing needs with those most at risk of being left behind, especially vulnerable and marginalized populations across all ages and backgrounds. Let me begin by acknowledging our co-organizers, the Government of Kenya, through KIPRA and KBNS, and our partners, the World Bank and UN Women. Your commitment to evidence-based and inclusive development is deeply appreciated. As Nelson Mandela said, there can be no keener revelation of a society's soul than the way in which it treats its children. This reminds us that inclusive development is not just a technical goal, it's a moral imperative. We must build a Kenya where every child, regardless of background, has the chance to thrive. Devolution was meant to bring services closer to the people and ensure that no county was left behind. And I must say that counties have stepped up. Yesterday, we saw in the nutrition side event how stunting chronic malnutrition has reduced in Kenya from 26% in 2014 to 18% in 2022. This is a remarkable achievement. Counties have also been stepping up and investing in social sectors. Up to 42% of their budgets now are allocated to social sectors like health, early childhood development, child protection, social protection, and nutrition. This is real progress. But today we face new challenges. With less donor support, raising debt, or resources are stretched. We must make every shilling count. Too often, the focus is on roads and buildings. And these are necessary, but real development is also about people. Infrastructure is important, but it's investments in children, in mothers, teachers, health workers, the elderly, and youth that truly transform lives. If we want to reduce poverty and build a more equal Kenya, we must prioritize social sectors. And we must act now. Why? Kenya has a powerful asset. It's young people. Children comprise up to 42% of the population, and youth another 31%. That represents 73% of the country. But if today's children are not healthy, well-nourished, and educated, they will grow into adults who are less productive and less able to contribute to the economy. Today, we are fortunate to have a distinguished panel from national and county governments, the private sector, civil society. We will hear from Dr. Elda Onsumo of KIPRA, who will share findings on poverty, inequality, and women's empowerment. And we will be grateful to launch two important reports led by KBNS. Let's use this session not just to reflect, but to commit to bold action grounded in the latest data and evidence. Public funds must be targeted where they make the greatest impact. I'm very much looking forward for the discussions, and asante sana.
And at this moment, we are going to hear from His Excellency, the Governor of Kisumu City County Government, Professor Peter Nyang'nyong'o. And at this moment, please welcome to the stage. I'll put a few questions to him, and he'll be addressing those questions. He's also going to ride and enrich the conversation that has already been set forth by the Madam Gebi. Your Excellency, counties are very critical in providing key social services like health, early education, water, sanitation, and social protection. Counties on average are spending about 42% in the financial year 2024-2025 of the resources in the social sectors. having increased this from about 39% in the financial year 2019-2020. That's a good progress and remarkable achievement as well. However, the number of children facing multiple deprivation is not reducing as fast. In fact, with analysis showing that it is increasing towards 55% in 2025, estimated to be about 12 million children. Your Excellency, with that thesis and that hook statement, I have two questions for you that you can present and make submissions to the audience today. What could be the missing link between increased social spending by counties and the non-reduction of the overall deprivation facing children, what scholars like you would call child multidimensional poverty? And the second question, so that you are able to give a reflection on this, is, in totality, is what action could be undertaken by counties to shift the needle where money spent leads to accelerated poverty reduction? Over to you, Prof.
Good morning, ladies and gentlemen. Let me begin by making one correction. I am the governor of Kisumu County, not Kisumu City County. Nairobi is the only city county in the Republic of Kenya. Kisumu County has the city of Kisumu as its headquarters, and the majority of people live in the countryside, so it's a county. Thank you so much. Now, look, it may look like a contradiction that as you put more money into the social sector, the figures of people still deprived seems to rise. There are two possible explanations. One, that you are getting more efficient in collecting data, and the focus, of course, is to get data on the more deprived so that you can improve their state of life. The other one is population increase. As you know, it is a common fact that as people got more affluent, they tend to employ methods of birth control better than the people who are less affluent. So as you improve the lot of people in the rural areas, they get more productive. Perhaps at the same rate as the people living in urban areas. But the urban people tend to control the rate of population growth than in rural areas. It's as simple as that. And that doesn't mean that you're not doing well. It only simply means that you are doing well. Because another thing you must remember, let us not over-romanticize investing in the social sector. If you are investing in education and health and not investing in infrastructure, people will not reach your health facilities. They need roads. They also need security. So you have to invest in good public administration to make sure that the security sector is working and that they're doing jobs, they're doing work, not just in urban areas, but rural areas as well. So I think KIPRA needs to do more detailed research, not take figures at their face value, but find out what are the dynamics lying behind those figures. I'll be very brief, ladies and gentlemen. And then after that, I'm sorry I will have to leave you because this is an equally urgent matter. And so at 9 o'clock, we were expecting to depart from Kisumu, dispatch the bodies about 10. Distinguished delegates, panelists for this important subject, ladies and gentlemen, good morning. Before I share my thoughts with you on this matter at hand, may I request that we rise up and observe a minute of silence in memory of the lives lost a few days ago through a grisly road accident that claimed 26 lives on the very day, 10 on the spot and 13 in the hospital as medics battled to save their lives. Sadly, yesterday, one more succumbed, bringing the total to 27 out of the 54 passengers in that ill-fated bus. So may I ask you to stand up for a moment of silence to say goodbye to our brothers and sisters who have left us before I leave. May the good Lord rest their souls in eternal peace. You may be seated. I want to thank the national government for partnering with my government to support the families, to give the families a dignified send-off which will take place tomorrow, Saturday, the 16th of this month. Plans are underway to remove the bodies today and transport them for the vigils. Ladies and gentlemen, the discussion that's about to take place at this side event is a very important one indeed. I am here to listen and to learn from the rich knowledge and experience from the great minds in the room as well, but unfortunately, I will not stay to listen and learn this morning. I was hoping to. However, I will discuss two issues, not from a point of finality, but to excite further conversation around them. And they are based on very interesting statistics. Listen to this, and I quote from the concept not shared by the partners organizing this side event. I quote, "Counties are very critical in providing key social services like health, early education, water, sanitation, and social protection. Counties on average are spending about 42% in the financial year 24-25 of resources in social sectors, having increased this from about 39% in financial year 2019-2020, as he has already mentioned. However, the number of children facing multiple deprivations is not reducing as fast. In fact, with analysis showing it is increasing towards 55% by 2025, this year. The question is, what could be the missing link between increased social spending by counties and the non-reduction of overall deprivations facing children, what we call child multidimensional poverty? And second question, what action could be undertaken by counties to shift the needle where money spent leads to accelerated poverty reduction? The disconnect between increased social spending and the slow reduction in child poverty is a critical issue that points to inefficiencies in how resources are used rather than the amount itself. It is not the amount that is less, it is how resources are used. The primary missing link is the fragmented, siloed approach to service delivery. Even with increased spending, different county departments often work in isolation, leading to ineffective and uncoordinated interventions. So, what are some of the key issues? 1, siloed interventions. The Department of Health might run a nutrition program. The Department of Water may sink a borehole, and education builds a classroom. However, if these services don't reach the same vulnerable child and household in a coordinated way, their individual impacts are severely diluted. A child who receives a school meal in education but drinks contaminated water at home will likely fall sick and miss school, negating the benefits. Focus on hardware and software. There is often a tendency to focus on visible capital projects, hardware, like constructing new health centers or ECD classrooms. However, this is often not matched by recurrent funding for the software, that is the trained teachers, health workers, essential medicines, and learning materials that make the buildings functional. This leads to well-built but under-resourced and underutilized facilities. Thirdly, inefficient targeting. Social spending is not always laser-focused on the most vulnerable. Universal subsidy or bursary programs can be captured by the less needy, while the households facing multiple deprivations remain unreached. Without precise data on who and where the most deprived children are, resources are spread too thinly to make a significant impact. Fourth, population growth and external shocks. In some cases, population growth may outpace the increase in spending, meaning the pre-child investment remains stagnant. Furthermore, External shocks like floods, a major issue in Kisumu, drought, or economic inflation can quickly reverse any gains made, pushing families back into poverty. Now, we should adopt an integrated service delivery model. Instead of departments working in silos, we must implement a convergent approach. This means different sectors coordinate to deliver a package of services to the most vulnerable households simultaneously. In Kisumu, we have piloted this coordinated budgeting approach where we encourage interdepartmental activities. For example, our Department of Agriculture is working with our ECD schools to implement agricultural practices that are exciting to children, like conical and kitchen gardens. These gardens, besides providing the schools with nutritious foods for the learners, also help to introduce them to agriculture. Likewise, the Department of Water is also obligated to bring water supply to the schools to improve sanitation and also to be used to irrigate the gardens. The community health promoters, agricultural extension officers, and social protection officers also work together in the communities to identify the most deprived households and work together to ensure the children are immunized and attending health checks. The family has access to clean water and receives climate-smart agricultural support. This creates a ring of protection around the child. 2, prioritize investment in the software. A functional facility is better than a new non-functional one. Our budgeting must reflect this. In Kisumu, for every new ECD classroom built, the budget must automatically include provision for a trained and salaried teacher and necessary learning materials. For every new health dispensary, there must be a guaranteed recurrent budget for a full stock of essential medicines and qualified personnel. This means prioritizing recurrent expenditure for service delivery over excessive new capital projects. And now with FIF, we find that commodity supplies to health facilities is sustained. Thirdly, focus on household economic strengthening. Social protection should be a springboard, not a permanent safety net. In Kisumu, we have since learned that freebies are not sustainable. In agriculture, we have introduced a subsidy funding model for inputs. We have partnered with Equity Bank for a subsidy wallet whereby farmers are linked to registered stores for various inputs. With their wallets, they pay a percentage of their needs, and the county government supplements a percentage directly to the store through the bank. This encourages ownership and commitment on the part of the farmer. This builds families' economic resilience, empowering them to eventually pay for services themselves and graduate out of poverty. Having shared my thoughts, allow me to resume my seat briefly and be enriched by a contribution from the great professionals who are here to share their insights on this and related subjects. But that will be very brief. However, as I mentioned in my opening, the bodies from that accident are being removed today from the morgue, and as the governor, I want to share the moment with the families at the mortuary, which will be taking place at around 11:30. I will then have to excuse myself before the conclusion of this discussion to be in Kisumu in time for that solemn moment. Thank you very much, ladies and gentlemen. I wish you a very fruitful deliberations, and I wish you a very happy stay in Homa Bay, the county of endless potential. Asanteni sana, Mungu wabariki.
Ladies and gentlemen, we now get to the next speaker. Allow me to welcome the board chair of KIPRA, Professor Paul Wachane, to move forward to the podium and welcome our keynote speaker, the Principal Secretary, Dr. Boniface Makoha, State Department for Economic Planning. Karibu sana, Prof.
The Principal Secretary, State Department of Economic Planning, who is our chief guest, Dr. Makoha Boniface, Principal Secretary, State Department of Children Services, Corin Okego, His Excellency, the Governor of Kisumu County, Professor Peter Nyang', the National Development Partners present, of course, led by UNICEF representative, the national government officials present, county government officials in the House, delegates from various agencies in the House, na watu wa Homa Bay, hamujambo. Good morning. My task today is very simple, basically to welcome our guests. And like as I looked at the theme of this site event, that is financing the social sectors for equity and inclusion, I was asking myself, are we all on the same page in understanding, in fact, what the theme is all about? Looking at the key recipient of the social sector investments, those are the G-Train, right from unborn all the way to reaching the social services transfer payments, it raises a lot of critical issues or questions that need be addressed. Right from our priorities in terms of investment in the health sector, nutrition, social protection, water, sanitation, and energy. The question is, does our national government, that's Kenya, prioritize these resources, or is it just a matter of pumping the amounts of it's part of its budget? Or which sector or which aspect is majorly favored in this budget allocation? Is what we are doing at the county government reflects the best practices as we look across the globe? Is there a mismatch that needs to be linked up? So those are some of the things that as participants today, I will be interested in understanding whether that's being done and this implication on the children's health and basically status. Without going into much details, of course, I had made some things I had wanted to ask His Excellency the Governor, but he was gracious enough to tell me that I should reach out to him, either face him or email him. Key that I was going to ask, especially those at the county governments, the CECs, that as Kipra were focused on public policy research analysis. That's developing tools from which we could get regulations enacted or which could guide our priorities. So we are calling upon the counties, the leadership of counties to consider in their gracious way allocating some budget, be it 1% of their budget to Kipra, so that Kipra can come and provide capacity building in these important sectors. And we will not limit ourselves, of course, to the issues of children, but we'll go beyond that. So providing capacity so that the county governments are better positioned to intervene in matters of children health, among other things, would be a critical opportunity and a critical priority. So with those few remarks, my job was basically to welcome our PS to come and make his remarks. Then the director, of course, Elder, will provide the technical aspects of what's required. So at this point, I would like to invite the PS, Principal Secretary, State Department of Economic Planning, our boss, Dr. Boniface Barasa, to come and address the gathering. Thank you, Dr.
Thank you, Prof. Before I start, I want to join the governor of Kisumu, who has just left, in condoling with the people of Kisumu for the loss, and by extension, Kenya. I believe there is a moment. Thank you. I believe that the loss is very devastating to all of us, and we need to join in and mourn with those who are mourning. Having said that, I want to take this opportunity to acknowledge the presence of excellencies. If we have any governor or the representative, I also want to acknowledge the presence of my colleague PS, Karen, members of Parliament, honorable members. I saw Honorable Atandi, senior government officials present, DGs, CEOs of parastatals, led by our own DGs, that is from Kipra and KNBS. Ladies and gentlemen, good morning. It gives me a great pleasure and privilege to join you today at this important side event dubbed Financing Social Sector for Equity and Inclusion at Devolved Level, co-hosted by the United Nations Children Fund, UNICEF, and UN Women at the sidelines of this devolution conference. Today, as we gather to elevate the debate on how better to finance social sectors, as we also launch two critical reports prepared by the Kenya National Bureau of Statistics, and these two reports are on the title Brighter Tomorrow, Breaking Cycles of Poverty for Kenya's Children, and the second report is on Women's Empowerment report. As you may be aware, the State Department for Economic Planning, of which I am in charge, is mandated to, among other functions, to manage the national statistics as well as undertake national census, economic and housing survey. The State Department undertakes this function through KNBS, the Kenya National Bureau of Statistics, whose key mandate is sector-specific data collection, report writing, and dissemination. It is within these confines that in the year 2024, KNBS, with the support of UNICEF and UN Women, initiated a study to provide the required evidence on social sector performance. Both the financial and non-financial indicators were dealt with. The study inspired by the need to monitor one of the core goals of devolution, promotion of physical equity and accelerating poverty reduction across all regions of the country. Distinguished ladies and gentlemen, children are at the heartbeat of our nation's future. To secure that future, we must understand how they grow up and whether we truly meet their needs. The Brighter Tomorrows, Breaking Cycles of Poverty for Kenya's Children report draws data from the latest Kenya Demographic and Health Survey, that is of 2022, and applies the UNICEF's multiple overlapping deprivation analysis to provide a comprehensive picture of child vulnerability in Kenya today. The findings show that Kenya is home to 21 million children, of which they form 42% of the population, while notable gains have been made to ensure that child survival education protection is guaranteed. A significant proportion of Kenya's children continue to face poverty, nutrition, inadequate access to basic services, and other risks that threaten their well-being. More than half of Kenya's children are multidimensionally poor, experiencing deprivation in at least 3 dimensions of their well-being simultaneously. These disparities are stuck with children in rural areas being more than twice as likely to be multidimensionally poor compared to their urban counterparts. If you look at the percentages, they are 66% in the rural areas compared to 28% in the urban areas. The regional inequalities have persisted, with counties such as Mandera, Turkana, Samburu, and Wajir reporting deprivation rate exceeding 90%. While on the other hand, counties like Nairobi, Kiambu, and Nyeri have the lowest rates of this deprivation. This highlights the urgent need for targeted and equity-driven interventions. The report further shows that only a small fraction of children benefit from social assistance program. In fact, indicative findings from the physical incidence analysis reveals that poorer households receive less government spending on essential services, especially education and health. And this report was presented, I think, the other day by Kipra. A very detailed analysis was presented on this, so I believe we can also have opportunity to look at it. On the positive, the report highlights that early childhood development spending is a smart investment. It is worth investing in the young population as a priority to reduce inequality. Similarly, apart from the report on the children, the Women's Empowerment Report highlights also a critical but often overlooked fact. Women's empowerment is a necessity. Women's empowerment plays a vital role in advancing gender equality and driving sustainable development. Empowering women is not only a matter of equity, it is a powerful catalyst for social change as well as a strategic investment for child survival and development. And I want to remind us that that is why we have even a resolution from the UN, Resolution 1325 of the UN Security Council, that is specifically on matters to do with gender, where women empowerment is given a priority. The analysis of women's empowerment in Kenya report was based on data from the 2022 Kenya Demographic and Health Survey report. As established in the analysis, 40.6% of women in Kenya are considered empowered. Women in urban areas, those with a higher level of education, and those from the wealthier households tend to be more empowered, highlighting a significant disparities when you compare with those from the rural areas. The analysis also establishes a clear link between women empowerment and better outcome for their children's future. It was observed that empowered women are more likely to ensure their children receive essential services such as health and education. Thus, they are less likely to be multidimensionally poor. Specifically, when women have access to resources, decision-making power, and social support, their children thrive. And you will agree with me and allow me to come to bring us back home here in Homa Bay. The governor is a woman, and us, people of Homa Bay, we are thriving. Ladies and gentlemen, these findings call for urgent action. I therefore echo the recommendations in the report, which include: 1, expand inclusive child benefits. Move towards universal systems that reach all vulnerable children. 2, improve access to health and nutrition, especially in poor and rural households, through immunization, food supplementation, and caregiver support. 3, reduce educational disparities by investing in infrastructure, teacher training, and inclusive education, particularly for children with disabilities. 4, strengthen child protection systems, including mobile birth registration and support for child-headed households. 6, build climate resilience by integrating child-focused adaptation into disaster preparedness and education system. And finally, promote women's empowerment as a cornerstone for child development through targeted social, economic, and policy intervention. As I conclude, ladies and gentlemen, I wish to extend my sincere gratitude to UNICEF and the UN for their continued partnership and commitment to advancing children and women well-being in Kenya. Special thanks to KNBS team, KIPRA team, for the analysis and the production of the 2 reports. The evidence is clear. The time to act is now. Let us commit across government, development partners, and of course, including civil societies, to ensure that every child in Kenya has the opportunity to thrive and that every woman has the power to help them to do so. Thank you, and I wish you a fruitful deliberation. Santeni sana.
Let's give another round of applause. It is indeed the time to act. The time to act is now. Thank you so much for even much more suggestions that we can consider as we move forward with financing social sectors for equity and inclusion, a side event that is brought to you by the UNICEF, UN Women, KIPRA, the KNBS, and the World Bank, with support from development partners that include the Coldad Hildad Foundation, the Podcast Foundation, the governments of Netherlands, Norway, Sweden, and United Kingdom. Indeed, we appreciate all the support. At this moment, we're about to launch two critical reports that two institutions led by the Kenya National Bureau of Statistics have produced and supported by UNICEF and the UN Women. And I'm going to invite a few dignitaries to join the podium so that we can together take these into success. I want to invite the Director General, Dr. MacDonald Obudho of the Kenya National Bureau of Statistics. He is the author and the lead of this publication, Karibu Sana Daktari. PS, Kalin, please join. Gabby, this can't happen without you and with all your support as well. We have the board chair as well. Kipra has contributed a lot to this as well. Please welcome the board chair. We also have the acting ED. Please welcome. Did I see the CEO of NGC? This is about vulnerable populations as well. Please join. The UN Women representative, anyone representing the UN Women? Please come, yes, Dr. Ali. At this moment, I want to invite the DG, Dr. MacDonald Obudho of the Kenya National Bureau of Statistics, to speak a little, give a hook statement about the publication that we are about to launch.
Thank you so much, Paul, for the chance, and all protocols observed. Good morning. Now, from the Kenya National Bureau of Statistics perspective, I'm really excited that we have gone this far, and we are at a point that we are now having two reports to launch. These two reports are actually coming from a data mining process, taking note of the fact that undertaking surveys would require a lot of resources, and once done, we do not just depend on the basic reports that are produced, and so we decided to go ahead together with a number of partners and supported by development partners to come up with the Child Vulnerability Report together with the Women Economic Empowerment Report, so that we are able to see deeply what the data talks about. And it's also a question of triangulation of information, where we are able to get from different reports data that had been done earlier to help us get to where we are today. And it brings out a number of salient issues which should be addressed by the county government, the national government, and all partners that are keen on the topic that we are dealing with today. And so from our end, it's a question of how well do you utilize that information that has been generated. Two, we get encouraged when we see progress made arising from data that we are producing. Three, we keep on updating the data that we are producing so that at any given time, we have reliable information to utilize. And for that matter, we have heard of 2022 Kenya Demographic and Health Survey, I know continuing to do DHS in Kenya would require a different approach, having had USAID going off, and that was the main funding institution. But we have also made good progress to bring on board a number of partners to come up with what we call the mini DHS, which we are going to conduct this year. We are actually at the stage of doing the pilot, after which we'll now embark on the main exercise. We have Bill and Melinda Gates Foundation also coming in to support the process. And so we are confident that within the year, we'll be able to get fresh information related to the demographic and health survey. On top of that, we are also working on the Kenya Integrated Household Budget Survey, which has already taken off. We are on our third week of data collection, and we hope that in the next 1 year we shall be through with the data collection, so that we can now analyze the report, and that will also be very rich, and we'll be able to mine a lot of information on various aspects, including poverty. So I would want to stop it at that. Thank you so much, Paul.
1, 2, 3, 4, 5. From 1, 2, 3, 4, and 5. Down. Women's empowerment in Kenya, developing a measure. The women's empowerment in Kenya, developing a measure. Thank you so much, the chief guests. Thank you so much, all the dignitaries, PS, Karine, Gabby, Paul, Professor, the chair of KIPRA board, McDonald, the author and the leader of this, Asante Sana, the CEO, National Gender and Equality Commission, who has a lot to do to monitor how these reports are implemented, the acting director, executive director, KIPRA as well, Dr. Simiyu as well, who provided all the technical support. Everyone else who is seated with us, thank you so much for being part of this historic moment when you are launching the 2 publications on reducing vulnerabilities among women and children. Thank you so much. Thank you so much. You may take your seat. Thank you so much, the chief guests. Thank you so much, all the dignitaries. Thank you so much, UNICEF, UN Women, KIPRA, the Kenya National Bureau of Statistics as well. Now, we get back to the program, and there is a common saying by Edward Demings, a mathematician and a statistician: in God we trust, everyone must bring data. So at this particular moment, we are going to hear more about numbers. It's going to speak to the report that you have launched. It's going to speak to everything that has been spoken before by the various speakers who stood here, including His Excellency Professor Peter Nyang'nyong'o, and Gabby as well, the PS as well, and the chair of KIPRA board, and what Dr. McDonald as well has alluded to. So at this moment, allow me to invite the acting executive director of KIPRA to come and make a technical presentation, Daktari. And after that, we are going to have a panel that is going to reflect on her presentation. I invite you to take keen interest and attention to her presentation. I truly believe she has made it very simple for us to understand. Karibu sana, Daktari.
we proceed with the presentation. And this is work that has been done with support from the various institutions, right from the support from our State Department for Economic Planning, UNICEF, UN Women, World Bank, KIPRA, KNPS, and other institutions. Why invest in people? As we have been told right from the beginning, Kenya is one of the lucky nations, whereby over 75.1% of our population is aged 0 to 34 years. And we know that going forward, most of the people who are going to work, not only in Kenya, but in the world, are coming from Africa. Hence, if we have to sustain our development, we need to look at how do we invest in the key sectors that relate to social protection and also that relate to national disparities that have to be addressed. When we look at the analysis that has been done, we find that from the Women Development Index and also the fiscal incidence analysis and also the analysis on the financial spending for the period from 2013 up to 2024, the analysis shows that as a nation, we need to put more emphasis and more effort on how we finance the sectors that are driving the economy. And here, the social sectors are quite important because as the GDP has expanded from 2014 up to 2022, the levels of poverty have not declined in the equal measure. Further, there is disconnect in terms of the inequalities across the regions and also across the counties. The dimensions that drive the spending and also that lead to the deprivations that we see relate to the following. First, the dimensions where children are most deprived are in sanitation, housing, water, and also in the living conditions. The analysis shows that where we have low levels of nutrition, we have low levels of well-being, which then means higher levels of deprivation. The other indication we have from this analysis is that multidimensional poverty levels increased between 2024 and 2025. The arid and semi-arid counties, where counties like Mandera, Turkana, Tana River had higher levels of poverty and multidimensional deprivations. We have hidden drivers of deprivations among children, and this relates to the level of education of the mothers. We also have the levels of persons with disabilities, whereby if a child is in a household where we have a person with disability or a mother with a low level of education, those have higher chances of being deprived. We also find that only 40.6% of Kenyan women are empowered, with major gaps by location, wealth, education, and also the marital status. The rural areas have higher levels of deprivation because in urban areas and also where we have women with higher income and more educated persons, then we have lower levels of deprivation. When it comes to health spending by category, and here we are looking at health, water, sanitation, and hygiene, it is quite evident that as a nation, these are sectors that we need to invest more so that we are able to reduce the disparities and deprivations that we are experiencing. When it comes to education, and here we have analyzed the pre-primary education and areas of social protection, it is evident that as a nation, we need to spend more in the foundations and the needs of children right from the early years, because they've been found to have more benefits and better outcomes even at higher education and also at tertiary levels. In social protection, here it is to counter the effects of deprivations, and for counties and regions to catch up, then this is an area of intervention so that we are able to get those who have been left behind to catch up with those who are ahead. And that's why most of the programs like the Inua Jamii comes in very handy. Under nutrition has a share of spending, as well as nutrition spending as a percentage of GDP, we find that the curve has flattened. What then that means is, despite the importance of spending on nutrition, the level of prioritization is still very low. And this is an area where we are advocating for more investments so that we are able to break the cycle of poverty and also improve human capital development in totality and eliminate any inequalities that come along with low nutrition and related deprivations, as well as putting more emphasis on education, health, and child development. The analysis further shows that when we spend less in the lower levels of schooling, it has long-term effects in the higher levels of education. This is because the children who are not covered in pre-primary education, for instance, they will not be able to progress to higher education, and hence, when we are spending in higher education, the people who will benefit at that level are from the higher income groups who will have managed to have their children go through the full cycle, right from the pre-primary, primary, secondary, all the way up to tertiary education. Then what is the call for action from this work? The first call for action is to invest in early childhood development for inclusive growth. And this covers right from the first 1,000 years of development to pre-primary, primary, secondary, and ensuring that as our young people graduate from education, they are able to link to employment, and the systems for transition from schooling to employment, which also relates to empowerment, have to be strengthened both at national and county levels. The second call for action is to expand social protection to reduce child poverty and build human capital for the nation and ensure that no one is left behind. Finally, we need to continue mobilizing more resources for social protection and also the social sectors so that we are able to have inclusive social transformation for our nation that fuels economic development and sustained growth. Thank you.
We are getting into an important session where we're going to have a reflection on what Dr. Elder has presented, a reflection on what the other speakers have presented to us. And at this moment, allow me to get into that session. We're going to have a few speakers who are going to, or a panel. I'm going to invite them, and you'll join me in welcoming them onto the stage so that they can reflect and give us a few thoughts. The first one is CPA PS Karine Agengo. She is the Principal Secretary at the State Department for Children's Services under the Ministry of Gender. Please join me in welcoming Madam PS Karine to the floor. I presume that the full bio and profile shall be screening and printing onto the wall. Karibu sana, PS. The next is Madam Mendy Jonjo. She's the director of KCB Foundation. Please join me in welcoming Madam Mendy Jonjo. We had invited the World Bank as well. They are not able to join us because of various reasons. And so we pass the apologies to the participants who are present in here. We had also invited an expert from public policy. He's a public policy specialist. Due to unavoidable circumstances, he had to travel yesterday back to Nairobi, but had presented and prepared his responses to the questions that we had wanted to ask him. And therefore, I'm going to invite Madam Wangoi Karanja, who is the chief of UNICEF Kisumu Field Office. She's going to be reading the responses of that specialist, and therefore we cannot direct questions to her. She can only take comments, and she can take them back to the author of the responses. Let's give them another round of applause. We may begin, and I'm going to start by a few questions. Some of the questions will be preceded by a commentary or a statement to put things into the context. So that will take some time, but I will ask all the panelists to take note of their questions and then take a moment and move on to the reflections. I'll start with the CPAPS. I'm careful about the pronunciation of her first name. She reminds me, Karine. Now, given the significant number of children who live in multidimensional poverty, about 55% actually, equivalent to 12 million children, what specific programs is the government of Kenya implementing to caution the most vulnerable children? The government of Kenya made a commitment to expand the coverage of households receiving cash transfers to 2.5 million by 2027. So far, the government has done very well by reaching 1.7 households in 2025 and indeed meeting the target for the period. However, children are not adequately covered. The government midterm plan target is reaching 741,000 children by 2027, with 2025 coverage being about 442,000 children. But PS, there's a gap of about 299,000 orphans and vulnerable children that needs to be covered by 2027. With that statement, then I have two questions for you, PS. What plans does the government have to cover the 299,000 overseas gap by 2027? And then two, which is related to my first question, what measures is the government putting in place to ensure adequate financing for the coverage of children and sustaining the same in the long term? Karibu sana, Madam PS.
Allow me to sincerely thank the KIPRA team together with the ministry for putting up a very good report that we have just launched, because this report is part of evidence that can help us in planning and budgeting for children. And I'm glad that we are having the chair of the budget committee in this discussion, because his office is critical when it comes to matters of budgeting for children. Now, looking at the statistics, that children form about 42% of our population. First of all, I want to say that the government has taken critical step in establishing a department that is now taking care of children. You note that this department was not in place until this year in April. And so that is one step that the government has taken, having looked at the past surveys that have been done on matters affecting children and seen that we need to first establish an office that purely takes care of children. And that is one good step that I can say the government has done. Next, the government also appreciates that we have vulnerable children in this nation. And one significant program that the government has taken is to have a cash transfer for the orphans and vulnerable children, currently reaching 442,000, as you have indicated, as of 2025. And this program stabilizes various incomes for households, improving children's access to health, nutrition, and education. However, we note there is a gap, and I will be addressing that in the next question. So this program has seen great impact on the children, retaining the children in the schools, and allowing their caregivers to provide for their food. And it is hoped that with this program, we should be able to address the poverty that is affecting orphans and vulnerable children. In addition to the cash transfer, the government also has a nutritional improvement program through cash and health education. We are calling it Niche, and Niche is a cash plus program that has been already piloted in 5 counties based on statistics showing high poverty levels in these counties. And these are counties of Kitui, we have Marsabit, we have West Pokot, Turkana, and Kilifi. If you looked at the report that was just launched, these are the counties that are deeply affected by poverty. And so the first pilot was done in these counties through a cash plus transfer to be able to take care of mothers who are pregnant and also children who are below 36 months. Why below 36 months? Because this is the age where a child develops. And why pregnant mothers? That a child develops from the mother's womb. If you don't take care of the nutrition of the mother, by the time the child is born, the child's development will already be affected. Therefore, this program acknowledges that the development cycle of a child starts from when a child is conceived. And we are planning to roll out this program to additional counties. And the next phase will be 20 counties, which have already been mapped based on the poverty index of these counties. Therefore, if you look at the report we have just looked at, the government is already focusing on an evidence-based approach to address the needs of the vulnerable. I also want to say that we are also looking at reaching at least 100,000 children with this program by 2027. And this will be able to address nutrition and also education of the mothers of the young children so that they use their local resources to improve on nutrition of these children. And that will have a multiplier effect when it comes to growth of children and consequently building our economy in the future. Through the Ministry of Education, the government also has put in place a school feeding program, and the chair of the budget committee here will confirm that this year the government has allocated 3 billion towards school feeding program, and this is mainly targeting again the ASAL region, because looking at again, the statistics we've just seen, this is the area that is mostly affected, and also informal settlements in the urban centers. So this will enhance school attendance, because you saw education is one of the key areas that where where vulnerable children are mostly affected. So there will be increased school attendance, and also food will ensure cognitive development for food insecure children. In addition to that, the government also has in place a presidential bursary program, and this is targeting 22,300 needy learners in the secondary schools, especially children from the vulnerable families and mainly orphans. And one thing I want to say about this program is to ensure the school transition into the secondary school, and also retention of these children in the secondary school. My comment on the issue of bursary, and it is one thing that we can deliberate on, that we do have various sources of disbursing the bursaries. We have the counties disbursing bursaries, we have the Ministry of Education, we have the CDF, and we do also have the presidential bursary. So my suggestion, as we are discussing today, that we need to have one single point, because we have targeted the vulnerable group. We have a system in place where we have a children officer all the ground to the sub-county level, who are able to identify the vulnerable groups through the chiefs. And therefore, if we use one system for disbursing this bursary, we'll be able to create a greater impact, and also it will ensure accountability is enhanced when it comes to bursary. So that is one thing that I would pass to especially the chair of the budget committee, and also our various institutions when it comes to even amending the laws to provide for one channel for disbursing the bursaries. Now, the government, recognizing that we also do have homeless families, has put in place Street Families Rehabilitation Trust Fund to take care of children living in the streets. And this fund ensures these families are rescued from the streets, rehabilitated, and reintegrated back to the society. And this is one successful program where, since 2018, we established there were about 46,000 families living in the streets. And so far, more than 11,300 street families have been reintegrated back to the society, while additional 20,000 are ongoing rehabilitation. It's a process that requires a lot of engagement, supporting these families through psychosocial support to bring them on board to accept that they can go back to this society. Therefore, this is also one key area, because anybody living in the streets is a vulnerable person. In addition, the government also has established a system for tracking vulnerable children, be it children in the emergencies. We do have what we call the Child Protection Information Management System that can track and locate where a child in need of danger or in emergency situations is rescued. And we monitor through data tracking and giving support in cases of emergencies like floods and fires. And this is also a system that helps in dealing with vulnerability when it comes to children. And the last program that I would like to talk about is we are rolling out this financial year a program to address adolescents, because we have established that there's a problem of teenage pregnancy in this nation. 15% of our girls are exposed to teenage pregnancy. And therefore, through our Kenya Socio-Economic Inclusion Program, we are rolling out a program in the near 3 months on teenage pregnancies. This is a partnership we are having with the World Bank, and we are hoping, again, we are targeting Samburu, Marsabit, Turkana, Migori, Bungoma, Kilifi, Tana River, Wajir, Mandera. Why I want to mention these are areas that we have established the high prevalence of teenage pregnancy, and we shall escalate this to cover about 60,000 adolescents with a view of giving them first an opportunity to go back to school, to enhance the education, and also giving psychosocial support when it comes to mental health, and also giving them life skills so that they can be economically empowered. You saw the report, when a woman is empowered, the child is also empowered, and poverty rate will come down. So those are the programs that the government is doing to support the vulnerable society.
Thank you so much, Madam PS. I've counted like 6 interventions. Interesting. And we hope that those interventions are going to cover the gap of in excess of 299,000 OVCs. Now, I turn to Mandy Jojo. She's the director of KCB Foundation. And Mandy, Kenya's constrained fiscal space is currently constrained by the shrinking donor funding that has been instrumental in financing some of the key programs. The Kenya's net official development assistance and official aid received in 2022 was about 2.73 billion US dollars, a decrease from 3.18 billion US dollars and 4.22 billion US dollars received in 2021 and 2020 respectively. Now, with this shrinking official development assistance, rising debt obligations, and persistent poverty among children and vulnerable communities, the need for innovative, sustainable, and inclusive financing strategies is urgent. Philanthropy, and that's the background that you have when I read your profile, especially the homegrown like KCB Foundation, will increasingly need to play a stronger role in supporting local government, and I trust and believe you agree with me. I have 2 questions for you, Madam Medi. What specific factors could be put in place for philanthropy like KCB Foundation to expand the footprint in supporting service delivery and development in Kenya? And 2, given that decline in official development assistance, in your view, what innovative financing mechanisms do you think Kenya can adopt to promote domestic resource mobilization to sustainably fund social sectors like health, education, social protection, and many others that fall within the social sector spectrum? Over to you, Madam Medi.
Thank you for your question. Good morning, everyone. So you are indeed right that aid is in decline. Anyone who's been watching what's been happening with USAID as well as other donors, we know that we're in a world where a lot of the philanthropic capital that has been flowing towards social services is on the decline. And one of the things that has also become very clear to anyone who's in this space is that this is an opportunity not just to try and do the same thing with less, but to really rethink how it is that we deploy and use capital. So to answer your question, some of the ways that KCB Foundation, as well as also indeed the KCB group has been looking at this issue, is around how do we have philanthropic capital being used as catalytic capital. So how do we have this finance that is primarily grants or primarily developmental in nature? How do we use it to spur either private sector or public sector capital in the country? And one of the most exciting things when we talk about social services, when we talk about things like ending multidimensional poverty, one of the most exciting things that can happen is if we look at counties as the engines for which jobs are going to be created in the country. And we all know that one of the biggest gateways towards achieving a lot of our socioeconomic rights is really the ability to have a job. So some of the exciting things that have been happening in this space involve the public sector meets private sector partnerships that spur job creation at the county level. And one of the most recent things that really speaks towards this work is joint investment as well as delivery platforms that support county level job growth, as I said. And it helps if you think of this in three things. In terms of one of the things we're very clear about is that we have to finance the workforce. And counties are stepping forward to do this thing where they are partnering with, for instance, KCB Foundation to make sure that they put in matching funds. KCB Foundation puts in matching funds to make sure that we're able to rekit as well as to retool the workforce, and not just the workforce of today, but also the workforce of the future. Beyond that, the other thing that counties are also doing is partnering with private sector. So in this case, let me say KCB Bank, to make sure that when it comes to enterprise development, we're able to really have counties putting funds primarily through the Fund Management Act that was passed that allows counties to set up MSME funds to support the enterprises in their counties. So through this, you're being able to see how public sector meets private sector is able to really spur the growth as well as the development and the catalyzing of enterprises in the county. And the third thing that is really most exciting in terms of what the counties can also leverage on is the ability to have value chain or ecosystem development in their counties, where let's say your CIDP identifies 5, 6 priority value chains. What has been happening is where private sector comes in to really leverage on these opportunities and work with the counties end-to-end financing. So for instance, KCB Bank does this. You're then now able to see job creation, you're able to see workforce creation, and you're also able to see enterprise development. And if I was to summarize in terms of the three things that are perhaps important to take home with you, is that when you leverage on philanthropic capital as catalytic capital, you're then now able to deliver large scale as well as very visible economic development in your counties. The other thing is you're also then now able to leverage private sector capital alongside county budgets as well as also what development partners may have. And thirdly, you're able to create durable jobs, you're able to create thriving local economies, as well as local industries without having to reinvent the wheel. So in summary, this is around jobs now. So being able to co-invest in skills and job placements that really match the county ambitions. It's also around money that moves. So being able to have end-to-end financing for value chains, so from production as well as market, and then growth with market. So we're talking about MSMEs that are backed with capital, technical assistance, and guaranteed buyers. And ultimately, the hope is, or the plan is, when you have jobs in the county, thriving MSMEs in the counties, multidimensional poverty becomes now something that is eradicated because we're now looking at multidimensional opportunity. Thank you.
Thank you so much. Thank you so much. It's no longer alternative financing, it's mainstreaming philanthropic sources of resources and finances into the public sector funding systems. Thank you so much, Madam Medi. I want to remind you the disclaimer that the next speaker is going to respond on behalf of the private sector, but she doesn't come from the private sector. And my question goes to you, Wangui Karanja. You have already prepared responses for the purposes of record and the audience as well. Kenya is facing a paradox of expanding spending needs and a reduced physical space to provide essential services like health, education, social protection, and water. Debt is taking a large portion of ordinary revenue, with about 6 out of every Kenya 10 shillings collected being spent on debt repayment. The public wage take about 25% of our annual budgets. And this means that the government must partner more with the private sector and seek innovative or what we call alternative finance to provide services. Now, Kenya seems to be performing better in PPPs, that is public-private partnerships on infrastructure and energy, but with lesser success on PPPs in social sectors like health, education, and social protection. So I have two questions that I would like you to address for the panelists to benefit from your thoughts on what potential exists for the government of Kenya to tap more on PPPs in social sectors like health, education, or any other subcomponent of social protection or social sector you may want to address. And two, from a private sector perspective, what are some of the factors that the government of Kenya could put in place to attract more private sector partnership and financing for social sectors?
Thank you, moderator and esteemed panelists. As mentioned, I'm reading this response on behalf of Anthony Mwangi, who was not able to be with us. So as a representative from the private sector, particularly from the vibrant ecosystem of micro, small, and medium enterprises that form the backbone of Kenya's economy, I am delighted to contribute to this discussion on financing social sectors amid fiscal challenges. To set the stage, let's begin with a high-level overview of Kenya's success in public-private partnerships within the social sectors. While Kenya has excelled in infrastructure, energy PPPs, we are seeing a growing momentum in health, education, social protection, and WASH. And some examples follow here. In health, the National Equipment Services Project has recently been launched. This initiative aims to equip hospitals throughout Kenya with state-of-the-art diagnostic and treatment technologies, ensuring their accessibility to all Kenyans. In July 2025, launch of a PPP at Moi Teaching and Referral Hospitals, College of Health Sciences, revolutionizing medical training, fostering skilled healthcare professionals. This innovation project aims to address the critical shortage of health workers in Kenya by providing modern and well-equipped facilities for quality education, training, and student well-being. In education, July 2025 launched PPP at Moi Teaching and Referral Hospitals, College of Health Sciences, revolutionizing medical. Okay, I think that is repeated. 1 second, please. Yes, that is repeated. So I'll move to WASH and social protection. According to water.org, Kenya, with a population of 54 million, 15 million Kenyans lack access to safe water and 37 million lack access to safe toilets. Growing water demand and water scarcity have become a notable challenge in Kenya. Climate change and population growth, urbanization, water pollution, and poor management of water resources have aggravated the issue of water crisis, which affects economic activities, food security, and education, as well as health. Now, addressing the first question, what potential exists for the government of Kenya to tap more into PPPs in these social sectors? The untapped potential is immense, especially if we broaden our view of private sector beyond large corporations to include MSMEs. MSMEs constitute over 90% of Kenya's businesses, contribute to 40% of GDP, and generate 80% of new jobs. These enterprises are often innovative startups and community-based firms, bringing agility and local relevance that form PPPs that formal PPPs sometimes lack. Rather than focusing solely on big-ticket projects under the PPPs Act of 2021, the government of Kenya should embrace a broader partnership perspective, including hybrid and informal models that drive outcomes in health, education, social protection, and WASH. Some examples of these: food for education, which is in the education and health sectors. They are scalable models partnering with county governments, parents, private donors to deliver nutritious meals to over 500,000 children daily across 15 counties in 1,900 schools. This boosts attendance by 10%, enrollment by 20% in some areas, and national exam performance. Addresses child multidimensional poverty. Chiporobo Center is another example. This is under education, a startup co-founded in 2023, collaborates with public high schools to enhance STEM education via robots and AI training. It has impacted over 10,000 schools in the last 2 years, scaling to 100,000 through partnerships with Microsoft Africa Development Center and Ekitabu. Currently, 100 students are in bootcamp at Microsoft ADC, fostering innovation and employability. These models, outside the formal PPP framework, show how MSMEs can integrate with public entities for great impact, potentially mobilizing billions in alternative financing while aligning with SDGs like no poverty and education and quality education. There's also Synergy. Synergy is in the wash sector. Kenya faces significant challenges in sanitation, with Synergy reporting that the country loses 2% of its GDP annually due to illness-related productivity losses. At current pace, achieving complete sanitation coverage could take 150 years. Synergy offers non-sewered sanitation solutions for urban residents that are 5 times more affordable than traditional sewer systems. In social protection, there are hybrid approaches like social impact bonds, could tie payments to verified poverty reduction. Village Enterprise DIB in Kenya and Uganda lifted household assets by 13.5% to over 13,800 people. These illustrate how PPPs, hybrids with philanthropy and impact investors, can accelerate Kenya's progress, especially for 12 million children in poverty. Turning to the second question, from a private sector perspective, what factors could the government of Kenya put in place to attract more partnerships and financing? Number one, streamline regulations beyond the formal PPP framework, include flexible incentives to MSMEs. Examples of this is tax breaks on social investments, viability gap funding for outcome-based models, expedited approvals via PPP Directorate's Project Facilitation Fund, which will reduce timelines from months to weeks. Number two, enhance risk sharing through blended finance. Public grants de-risk projects for private players. And examples of these are Ghana's WASH initiatives, which mobilized 50 million euros. Number three, build capacity and dialogue platforms, expand ministerial stakeholder forums to involve MSMEs in co-designing initiatives, ensuring transparency and corruption-free procurement. To prioritize impact. Number four, prioritize impact metrics over inputs, adapt an SIB-like structure where payments reward results, attracting philanthropies like KCB Foundation and investors seeking SDG-aligned returns. Incentivizing models like food for education could scale nutrition programs nationally. Supporting Chiporobo partnership could embed AI in curricula for equitable STEM access. Ultimately, by viewing the private sector holistically, including our 7.4 million MSMEs, the government of Kenya can turn fiscal constraints into collaborative opportunities, fostering innovation that sustains equity and inclusion for generations. Thank you.
Thank you so much. We want to thank Anthony, who has made that submissions. He is the CEO and founder of Visible Industries. And asante sana, Ongoi, for fitting into the shoes of Anthony. At this moment, because of time, I will allow each of the panelists to summarize their thoughts, reflections in less than 5 words, so that, as we say, if you don't remember everything else I said, there will be 1, 2, 3 things I want you to take home with yourself. I'll start with Mendy.
So my take homes are 3 things. A good, well-structured county meets private sector meets philanthropy model is able to deliver on 3 very key things. It can deliver on jobs. It can deliver on jobs now. It can also deliver on money that moves. So end-to-end financing. It can also deliver on growth with markets. And together, this financing is able to jumpstart workforce development in counties. It's able to jumpstart value chains that are aligned to CIDPs, and it's able to deliver private sector financing for all MSMEs that these value chains are supported by. And this is something KCB Foundation, as well as the KCB Group, has been proudly partnering with counties. We have over 29 counties in partnerships, as well as creating jobs. So we're about 150,000 jobs created just in the last few years. Thank you.
Thank you so much. Thank you so much, Mendy, for that. PS, Madam PS, less than 5 words.
Thank you. And first of all, I would like to say that for sustainability in terms of financing, social sector, one of the things that we need to have is a coordinated approach to partnering both the having a collaboration between the county government and the national government. We saw how fragmenting approach is leading to fragmenting also our resources. Therefore, for us to target our resources to reach the social needy and the vulnerable communities, we need to have a coordinated approach both at the county level and also at the national level. The next that I would recommend would be to ring-fence the budget allocation and also come up with alternative ways of raising funds when it comes to mobilization of funds. We do have companies that are having probably negative impact when it comes to issues of nutrition. We could tap into a percentage of the income of this private sector in bringing on board additional funding that can fund the Child Welfare Fund, which is already in place but not operationalized, for us to be able to reach the vulnerable children. Thank you.
Thank you so much. Thank you so much. Please join me in thanking Madam P.S. Colleen Ogengo. We also have Madam Mendy Jonjo, Anthony Mwangi in absentia, and Madam Wangoi Karanja, who fit into this panel. What an esteemed panel, distinguished guests. Ladies and gentlemen, let's give them a round of applause. Thank you so much. And allow me to give them a standing ovation because it's a very powerful panel of ladies, eminent ladies. And you shall remain standing as I invite the following. We have Dr. Elda Osunu, DG. We also have Dr. McDonald Obudo as well. You come to the stage so that you join the team. We have Professor Paul Wachana, the chair of the board, Peter Nyangnyong, please join. Gabi as well, please join. PS, I know he has left. PS, Dr. Boniface, a representative, but the DG is here. We have some goodies for these eminent, distinguished guests who have made this event possible. I'll ask Denge or is it Wangoi so that we can pass the gifts to them.
Childhood development for inclusive growth, expand social protection programs to reduce child poverty and build human capital in Kenya, enhance intergovernmental coordination and financing synergies to expand fiscal space to accelerate poverty reduction, particularly for children, women and youth, and persons with disabilities. So let's take these resolutions forward with renewed commitment and urgency. And on behalf of UNICEF and our co-organizers, KIPRA, the World Bank, UN Women, I want to extend our deepest gratitude to all who have made this session a success, our distinguished panelists and speakers, the PS State Department for Economic Planning, Acting KIPRA Executive Director, Dr. Elda, our Chief of Social Policy, Dr. Gabi, PS Welfare Social Services, Karen, His Excellency Governor Nyong'o, Ms. Mendi Njonjo, Anthony Mwangi in absentia. Thank you for your leadership, your rich contributions, and your unwavering dedication to inclusive development. Our moderator, Paul Courier, thank you so much. Thank you for you skillfully guiding the conversation and ensuring everybody's voice was heard. Our development partners, Conrad Hilton Foundation, Porticus Foundation, the government of Netherlands, Norway and Sweden, and the United Kingdom, thank you for your continued support and solidarity, and also to the delegates in the room and those who joined online, thank you for your engagement, your well, there were no questions, unfortunately, but our commitment, I know there'll be joint commitment to take some of these important matters, issues, points discussed forward. Thank you very much. Also to the technical team, the organizers, we thank you for providing this great space and for supporting the event to ensure that we can deliver messages that inform actions that change lives and save children. I hope I leave here, we all live here, informed and inspired, and that no child, no woman, no community will be left behind. Thank you very much, and good morning.